the future of Norwood Hospital and the other 5 Caritas hospitals, and their ability to continue to provide quality, affordable, and accessible care to their respective communities. Healthcare for All is a statewide advocacy group that seeks to create a consumer-centered healthcare system that provides comprehensive, affordable, accessible, culturally competent, high-quality care and consumer education for everyone, especially the most vulnerable. And we work to achieve this as leaders in public policy, advocacy, education, and service to consumers in Massachusetts. We work to bring social justice values into the healthcare system. So we're looking forward to engaging in the public process before the Attorney General and the DPH, both through these formal hearings and throughout the entire deliberative process throughout the summer and fall, in order to analyze the impacts of the proposed conversion and to see whether it will indeed satisfy the Attorney General's standard of serving the public interest and the needs of the host communities. This conversion process has added importance as the stakes appear to have grown over the past few weeks. According to the Boston Globe, Cerberus appears to be not stopping with these 6 proposals with the Caritas hospitals and is already looking at its next batch of acquisitions in Rhode Island and in the Merrimack Valley. What is decided here will have an impact on future considerations in the entire healthcare system here in the Commonwealth. We believe this review needs to be carried out on 2 levels. First, on a macro level, we want to ensure that there's a comprehensive analysis of the impact of this conversion on the entire Caritas network will have on the Commonwealth's healthcare system. What does this conversion mean to other healthcare facilities, such as community health centers and other safety net hospitals, and to the overall mix of resources and services across the Commonwealth? On a local level, we want to ensure that the Attorney General and DPH conduct distinct comprehensive reviews of the proposed conversions of Norwood Hospital, as well as individual reviews for each of the other 5 hospitals. The current proposal to convert these hospitals from nonprofits to for-profits does little to distinguish between the needs of the 6 different hospitals. What is needed at Norwood Hospital is not necessarily what is needed at the Carney. It's essential that the proposed conversion of each hospital gets the review and attention that it needs, and in order to document the needs of each host community and the ability of the new owners to address these specific needs. This process must not be one big bundle, but 6 unique and community-specific reviews. Healthcare for All believes that community hospitals are an integral part of the community fabric and its well-being, as the previous speakers have talked about. When well-run, these hospitals provide vibrant and robust outreach care and support for the communities they serve. We need to make sure that these hospitals continue to provide top-notch, affordable, accessible, and high-quality care that we know and expect from facilities like the Norwood Hospital. We certainly understand the number of issues currently facing Caritas and its operations, as Dr. Delatorre outlined. We understand the pension fund is broke and know the physical plants are in need of help. We know Caritas has been looking for an infusion of capital over the past 5 years. And you will hear, you have heard, and you will hear throughout the night the testimonies of staff from the hospital showing their approval for the proposal because it will fund the pension system and improve the facilities in which they work. The investment of capital is certainly a good thing for the past, current, and future workforce here at the hospital. While we acknowledge the benefits of the influx of out-of-state capital, Healthcare for All enters this review process with a healthy dose of skepticism. The proposal in front of us considers selling 6 nonprofit hospitals owned locally by the Archdiocese to the New York-based private equity firm Cerberus, a venture capital firm which has never owned nor operated a hospital. The conversion raises many questions. And we're here today and focused on this conversion process because we want to make sure it's the right deal to make, not only for jobs and pensions, not only for construction projects, not only for the local tax base, but for the health care that this community needs. We know that Caritas and Cerberus have negotiated many hours, many weeks, many months to formulate this deal. Now we need to expand this process to a new set of eyes and give the public a seat at the table. We're particularly concerned that this public involvement review process has begun, yet as the public, we still do not have all the pieces of the purchase agreement. The proponents have yet to submit Schedule 8.10, an appendix to the purchase agreement, which is intended to detail Stewart Healthcare System's indigent and low-income care policy. We're concerned that that's not part of the packet that we've received, and for many communities, this is a #1 concern. Yet halfway through this public hearing process, we still don't have a complete proposal for the public to look at or comment upon. As we begin to analyze and look at the pieces of this conversion process, a number of questions arise. One, as the profit motive is now a brand new variable in this hospital's financial equation, what impact will the need to satisfy investors have on the quality, affordability, and accessibility of care? How will Stewart run their programs differently to meet the financial needs and demands of their institutional investors? Who is Cerberus, and who are the people who will be running the board of directors for this network? Arthur Halper, Brett Ingersoll, James Lenigan, John Snow are 4 people on the new 7-member board, Stewart board, who are Cerberus staff, most likely are based in New York, and are most likely Yankee fans. The proposed conversion affirms that Cerberus will run these hospitals for at least 3 years before reselling. Is that the appropriate amount of time necessary for this company to ensure the long-term stability and sustainability of this hospital? Why not agree to a more long-term view of a 7-year commitment? What happens after 3 years are up? And what is to prevent Cerberus from making radical changes such as eliminating key healthcare programs or even closing down a hospital? Does the price tag upon which the 2 parties have agreed adequately represent the true value of the network? We urge the Attorney General immediately to use its power to hire an independent analyst at Cerberus's expense to evaluate the assets and liabilities of the network. Fifth, why has Cerberus failed to propose the formation of an independent foundation in Norwood to provide the community resources to address local health concerns? Such foundations are usually a staple in similar hospital conversions. As we better understand and document the healthcare needs of the community, we also need to ensure that community benefits and investments provided by the hospitals are not only maintained but improved upon. For example, what are the hospital's plans to address issues such as mental health care, cultural competency, children's health, transportation issues, green building principles, HIV services, teen pregnancy, substance abuse, domestic violence, and community hiring practices? We are ready to work with all parties, especially the public, to do the due diligence necessary to answer these questions. We are encouraged by the improvement of management of the Caritas operation over the past 2 years and the ability of its current management to right the ship. With the help of so many residents at state, we want to make sure that the potential new ownership will have the capacity and the will, now and in the future, to continue to provide accessible, affordable, and high-quality care to the residents of the Norwood area and beyond.